It's very rare for a single trial to rapidly change clinical practice, but INTERACT3's got quite a good momentum behind it and a head start. For example, it's the biggest intracerebral hemorrhage. It was conducted in different healthcare settings, a broad range of patients. Most of the trials in intracerebral hemorrhage to date have included, and for good reason, have included patients that tend to have a milder degree of the condition. It's quite difficult to recruit very sick patients rapidly in the emergency department. The doctors are often very busy getting them organised for early surgery. So we have got all types of intracerebral hemorrhage, and we've assessed the intervention in the context of different levels of background care. So the results are very generalizable, but because it's an implementation study, it sort of shows that when you change systems of care, it works. And again, that's the big advantage of our trial, which is different from others. You generally include individual patients and show a treatment effect. You get evidence. But then, as you know, there's always this evidence practice gap, is how do you apply this evidence of a generally individual treatment? How do you then bring it and apply it back into clinical practice? How do you organise the systems? How do you pay for it? How do you train people? And we've shown within INTERACT3 the pathway of which you can do that to change systems of care. We did use a unique additional aspect in our trial, which is called a process evaluation, where you do formative interviews with various healthcare providers within the system as we were rolling out the intervention to understand what was working, what was not working, where the barriers were to implement the intervention. We got a lot of learnings there, which again will help us to promote and guide the implementation of the care bundle in different jurisdictions. So I would expect that the results of INTERACT3 will be warmly received and would then be applied within guidelines in the immediate future as a standard of care. And then obviously level A evidence would then incorporate these pathways as part of quality assurance measures and training and accreditation.